The lead-off paper in the November 15 and 22nd issue of JACC is on serial changes in cognitive function following TAVR. We are at TCT 16, and I am with Josep Rodés-Cabau, who is from the Quebec Heart and Lung Institute at Laval University in Canada. First, some background. This has been a hot topic for some time now. Why did you do this study?
We did this study in order to have a very strict and systematic evaluation of the cognitive status of patients undergoing TAVR. There were several studies that were done, not really a lot, and a lot of talk around these cerebral emboli problem, cognitive status problem post-TAVR. And this is the reason why we decided to implement, among all our other exams, cognitive tests, but not only the usual ones. We did the Montreal Cognitive Assessment Test as the most important one, and then we evaluated more complex cognitive functions.
Well, it's probably important to note that most of the data to date are really short-term studies. So you're really the first to look at some moderate follow-up of these patients up to a whole year. So what did you do, and then what did you find?
What we did is we administered cognitive tests to the patients before the procedure. Then we repeat these tests at 30 days. And then we repeat again this test at 1 year follow-up. And what we observed is that when you take the test as a numerical value, you see that there is a global improvement in the cognitive status of the patients undergoing TAVR. And this is true for what we call the MOCA test, which evaluates several cognitive functions, and also for the other test. This is an important observation. And then we said, okay, this is a numerical value. It can be also influenced by, let's say, the training process, meaning when the patient does the test a second time, he remembers probably something about the first time, etc. And then to take into account all these potential limitations, we used a reliable change index, which takes into account all these potential issues of repeating cognitive tests. And when using these, you can dichotomize patients who didn't change, patients who improved, and patients who deteriorated the cognitive status. And using this index, we saw that about 1 out of 10 patients in the short term had some degree of deterioration, and only a minority of these patients had still this deterioration at 1 year follow-up.
So most showed recovery?
Most recover. During the period of 1 year follow-up, some cognitive deterioration appears.
So how many patients, what percentage showed some cognitive benefit from the surgery?
It's around the same. It's around also 1 out of 10 patients showed, using this reliable change index, showed a significant improvement.
We know from some of the earlier studies that there are many reasons why there could be some deterioration, cognitive effects, negative. What would explain the positive cognitive effects that you're seeing?
In prior studies, in fact, there was a rate of cognitive deterioration that was similar to ours, and also some studies observed cognitive improvement. The cognitive improvement we observed globally as a numerical value, but also in out of 10 patients when we use this dichotomization, is probably related to an improved cardiac output that you have after the procedure. It is well known that low cardiac output can influence the cognitive status, and in addition to this, the patients feel better. There are mood circumstances. There are, I think that other factors that probably can influence the global
It's also great relief. They came through a procedure well.
Yeah. Yeah, that's true.
That's got to be a reduction in stress. Now, in your discussion, you addressed how does the TAVR results compare with what we know about cognitive effects of SAVR?
I think that if we look at the results we obtained, the percentage of patients with early cognitive deterioration post-TAVR has been evaluated at around 50%. There are many studies, and most of these patients recover over time, but I would say that is always very difficult to compare when it's not in a randomized fashion, but still I think that the study points out that probably the patients are doing at least as well as those undergoing SAVR, and maybe better than those undergoing SAVR.
So this is certainly encouraging. Short-term improvements in cognition post-TAVR and remaining stable to one-year follow-up. Was there any way to predict who did really well and who didn't?
Unfortunately, the number of patients included in this study, that was 51, was limited. And we will need much larger number of patients to demonstrate or to determine the predictors of cognitive deterioration and also cognitive improvement. The problem, again, is that this is somewhat variable. There are some patients that deteriorate immediately after, then they recover. There are some patients with no changes immediately after, and then over time, maybe because of the age issue, etc., they have some cognitive deterioration, meaning that when you evaluate cognitive changes over time, I think that you realize that this is a very complex topic.
So you've done the study. What will you tell patients now before they have the procedure?
What we will tell patients is we tell them about the clinical apparent stroke rates that are currently in the literature, and those also observed from the data from our patients in our center. And then, honestly, in terms of cognitive status, we said that there is a possibility of mild cognitive deterioration, but that in general, this is not going to occur. And then there is even the possibility of some cognitive improvement following the procedure.
Well, congratulations. I think this adds quite a bit of interesting material to this whole discussion that has been going on for now, like at least the last year or two. And this happens to be in the JACC issue for November 15th and 22nd. It's a dual issue, and it is on serial changes in cognitive function following TAVR. And here we are at TCT 16. Please look around for our coverage. For CardioSource World News, I'm Executive Editor Rick McGuire.